approach to conventional challenges. A very unique topic for discussion in the times that we are right now in. I would just like to invite, and it's a great, great honor to have with us, is Dr. Christoph Nabzdyk, who is on the front line of this pandemic. So let us all just take a moment to give a big round of applause to all the frontliners worldwide. So, Dr. Nabzdyk, thank you so much for your time. You are an ICU doctor treating, you're seeing the worst basically. So, what is your insight that you can share in comparing your new normal duties to what you have to deal in the last 2 months?
Well, first of all, thank you, Priya, for having me. It's very kind, and thank you for the kind, applause and everything, appreciation. I would say that, I have to say that I'm very fortunate to be where I am at Mayo Clinic in Rochester. It's our situation is probably very different from many other academic or otherwise hospitals in the United States, especially the epicenters of the COVID pandemic. And particularly the East Coast, with New York City being the worst affected. So while our daily life has changed quite a bit, because I usually work in the heart and thoracic cardiac surgery field, and so I see a lot of the patients with failing hearts and lungs. We have shut down a lot of the what we call elective surgery. So our volume in that sense has gone down in anticipation of the big wave that is now starting to come to us. So because of our regional differences, we haven't seen as many patients yet as my colleagues are seeing in New York. And maybe I should, rather than my experience, reflect a little bit upon what they are experiencing, which is really a very, very overwhelming flood of very sick patients. And it's very important to stress that these patients are not always the elderly and the people with comorbidities, which of course there are many of them, but there are also very, very young patients with absolutely no health issues whatsoever up to that point. And these patients, while many of them will survive, unfortunately, a significant number of them will have complications and might in fact pass away. And I think that's one of the major problems that I think people like us who are used to a very high fidelity medical system are struggling with, is that the system at times, especially in these places, gets overwhelmed, and the complex care that these patients deserve can sometimes not be provided. And because they are so frail and so fragile, maybe at times we feel that we cannot give them what the patients need, and we have outcomes that are undesirable. And I think, like any of my colleagues who's worked in medical field, and especially in the ICU, we all have memories of patients that passed away, and some hurt more than others. And of course, it's always the young, it's the mothers, it's the innocent that haven't had the chance to life. And I think my colleagues are seeing more of these in a short period of time now during COVID than they have seen maybe over their entire lifespan. And again, I think a lot of that comes to what Frank has pointed out earlier. There's some areas where you have these concentration of patients, and where ventilators might be short, and therefore care cannot be provided in a way that is would be appropriate otherwise. And then you have areas where things are a little bit less difficult, as in, for example, the Mayo Clinic here, where we have so far an abundance of resources, because we are very blessed at the institution here in general, and we are in an area where overall less people live. So in my case, I'm planning to. Things are still very organized. We are not overwhelmed yet. We are seeing a surge now, and which is just again geographically delayed. I would say, and not to paint too dark of a picture, I think these months have also, and I will echo what Frank has said, that also brought up a lot of opportunity for people and brought people together to be inventive, innovative, find new ways around things. And in a very short period of time, thousands and thousands of research articles and approaches to the care of these patients have been have been brought forth. We are getting smarter in terms of how to treat these patients. And while we are still away from having a vaccine, we are having a lot of success in both with medications as well as with adjustment to the general medical management. So I think there is a lot of hope, and there's a lot of ingenuity, and I think if we keep in mind that this is something that we will, for the most part, get through, and we use it as an opportunity to actually work collaboratively rather than pointing fingers, I think this could be, in the long run, a success for the majority of us. And in the meantime, we have to be very patient and very disciplined to not prematurely take off the guard and allow the usual life to continue, because I think that's where it is, a lot of people feel like they can do because of their personal health being good and being young and everything. But I think the data shows that it's not that simple, unfortunately. So I think I'll leave it at that.
Share with us the learning and the advice.
Yeah, so I mean, this was the first time in probably 20 years that I spent as much time with my family, and well, back then I didn't have a wife and a child, so the first time ever, pretty much. And I would say that this, since all of us experiencing something like this across the globe, I think it really can unite people, and I hope that it will. And as Frank said, we should not point fingers. Instead, we should eventually reflect upon this as an opportunity to grow together as a community and use this time to be innovative, to be thankful, to be more attentive to our neighbors, to our more vulnerable parts of the population, and just use it as an opportunity, really, and to reflect upon your own life and what you want to do in life, and use it as a true chance to start something new, maybe. And I think that's what we have been talking about, the opportunity that is within this temporary crisis.